Welcome to this episode of Lifestyle Matters. Once again, I am Savina Nithyanandan and joined by Fergal Armstrong on this episode. Today, welcome Fergal.
Hi Savina, how are you?
I'm good. So today I thought we might explore stress. It's quite a common thing that lots of us face, and especially in the last couple of years, living through a pandemic all around the world, lots of people have faced stress. But I guess before we get into the nitty-gritty of it, I thought it might be good to actually discuss what is stress and, how can we differentiate it from other mental health problems like anxiety and depression?
Yeah, that's a great question. And I've reflected on that frequently. I mean, even when we think about the depression, anxiety, stress questionnaire, the DAS, we have the DAS 21 and the DAS 42, and there are separate columns for the diagnosis of depression, anxiety, and stress. And one of the complicating factors is that the symptoms of anxiety are basically identical to the symptoms of stress. So how do you separate out these two apparently different separate diagnoses? And a wise teacher once told me the following, and I've never forgotten it. He said, depression is fear of the past. Stress is fear of the present. And anxiety is fear of the future. And that also brings me on to this idea about the fact that when we're talking about anxiety, in particular generalized anxiety, we're talking about persistent worry that occurs in the absence of triggers. Whereas with stress, we always think of stress as an emotional response to triggers. And that's another way of thinking about the difference between stress and anxiety. Another way of thinking about stress is it's the emotional response that occurs as a result of an evaluation. It's called the threat evaluation. So when we evaluate threats in our lives, if we evaluate those threats as being less than our ability to cope, i.e. our resilience, then we don't get stressed. But if we evaluate our resilience to be lower than the level of the stress, or that the stress exceeds our ability to cope, then we do get stressed. So that's another way of thinking about it. It's in terms of the emotional response associated with our threat evaluation, which then brings us back to cavemen. If you go into the African savannah, the animals there are always on the lookout. They're always jumpy. The wind rustles the leaves, they run away. And there is a survival benefit to that because the people that were relaxed, or the animals certainly that were relaxed on the African savannah, got eaten. They died. So stress is part of our natural makeup. We can't get rid of it because it is our response to threat. And in appropriate circumstances is very healthy. But unfortunately, in the modern day world, we have threats to our existential existence that are not the same as they were, in caveman days, but yet we have the same old responses, which are perhaps not so good for us in modern times. And so you talked about the prevalence of it. I was thinking, I read recently that, but this is pre-COVID, but 30%, 1 in 3 people experience stress on a daily basis that has an impairing effect on their function. I mean, it's just so prevalent. So, reflecting back to you, what would you say, how would you describe your understanding of the diagnosis of stress and how common it is?
So I'd probably go back to what you said just now. I think you've just sort of summarized a few versions of it, and one of those would be my version. So stress, I don't think is a diagnosis. It is a process, as what you've just said. And it is basically how I find that stress is more when we can't, it's just that demand and what's expected out of us, and what we can actually, what resources we may have to cope with these situations, that the demands that our body or our situation demands of us. And it also comes down to personalities. So, for example, task A might be super stressful for me, but for you, it might be, just, a little slightly stressful. It wouldn't cause a great deal of anxiety. So it comes down to personalities too, I find.
I also feel it comes down to resilience, because 2 people may be given the same task, and for one person it's fine, but for the other person it's the straw that breaks the camel's back. So you have to understand that everyone carries around them what I call a stress bucket. And all the stresses in our life go in, and there's a little hole in the bucket, which are stress relieving mechanisms, and all the stress flows out. But sometimes we have higher levels of stress because we can't cope with the stress, and therefore a task that would previously not worry us, if we're in a situation of heightened stress, suddenly overwhelms us. And so, we have to think about our time-based resilience as well as personality, as well as the task itself.
Yeah. And I guess I would also probably bring it, if we're thinking about lifestyle medicine, we talked about sleep, for example, earlier on in the episodes, during sleep, all the restorative processes that happen to our emotional part of our brain and things like that. If you're not having good sleep, then the amygdala, for example, does not sort of do what it has to do, repair itself overnight. Yeah. And then in the morning, you wake up, you'll be more anxious. And so any small little stress can amount to a bigger response. Yeah. But stress is also good. If we can find ways to utilize the stress to actually be more productive in our day, it actually can sometimes drive us to perform better.
Exactly. That's exactly what I agree with. The key thing is that we have to understand that we cannot eradicate stress from our lives. Stress is a part of our lives, and it's part of our survival mechanisms. And so there is a famous curve called the Yerkes-Dodson curve, which describes our response to stress. And at low levels of stress, our performance is low because we're bored. At moderate levels of stress, our performance is maximal because we're stimulated, and that's called eustress, E-U-S-T-R-E-S-S, so eustress. And then at high levels of stress, our performance deteriorates again because of worry, anxiety, where we start getting these mental health diagnoses. And that's what we would also describe as traditional stress, when our ability to cope is exceeded by the perceived threat. So we need stress in our lives. We need moderate levels of stress that we can cope with in our lives to actually improve and maintain function. It's just that when it becomes too much, that's when we have these mental health issues. So it's really important to understand you cannot live a stress-free life.
Yeah. And I guess that's when, de-stress happens. Distress happens.
Yes.
And that's when you actually start getting that negative effects of stress on our body. So, you start having trouble sleeping, you feel nauseous, headaches and things like that. And this, I guess, progresses to other mental health issues.
Exactly. Yeah.
So I guess if we wanted to, I guess the next thing is really, why are we so, how does it sort of affect our health, in terms of stress and distress?
Really, I think it's, if you look at every organ system in the body, there is a disease that will affect that organ system that can either be directly or indirectly related to stress. So let's look at the nervous system. So when we are stressed, we activate our sympathetic nervous system and we deactivate our parasympathetic nervous system. And the sympathetic, and that augmentation of the sympathetic and the deactivation of the parasympathetic permeates through our entire bodies. And if we look in the short term and the effects of that, so we have, high heart rate, we have high blood pressure, we have increased cardiac contractility. So we pump a lot of blood through our vascular system. And then we have changes in our vascular tone that basically redirect blood from our gut to our brain and our muscles. So our blood pressure increases. Our heart rate increases. Now, imagine what that does to someone who's got a precarious cardiovascular system. That puts a stress on it. We also breathe faster, so we're shifting in and out a lot of air. Now, imagine what that does to someone with asthma or COPD. That can adversely affect someone's respiratory function. It can actually trigger an asthma attack. That rapid shifting of air.
And it can also cause a bit of hypoventilation, and then people start getting pins and needles around, numbness and tingling around the lips. Yeah.
So it causes hyperventilation, which then causes a relative hypocalcemia.
Hyperventilation, yes.
That causes this numbness and tingling around the lips. And people think they're dying because of it. And, because so they get this numbness and tingling. They then get this, the hypertension, the palpitations in the heart, the high blood pressure, and they get a bit of an ache. And not because they're having a heart attack, but because the muscles in the chest wall are getting sore and tight and rigid. but they think they're having a heart attack. And so, that what we're describing there are the typical features of a panic attack, which is really the pointy end of stress, isn't it? But yeah, so if we then move on to the gastrointestinal system, you have all of these stress-related phenomena, like, the diarrhea, the nausea, the vomiting, the spasms of the gut, the bellyache, the butterfly. So especially when we're shifting our blood supply from our guts to the rest of our vital organs, like the heart and the muscles, that shift in blood supply will also cause sensory changes, which some people describe as butterflies. And of course, diarrhea is perhaps one of the most interesting phenomena, because actually the sympathetic tone actually allows us to retain our stools. But when we become overstressed, we have actually a paradoxical overdrive of our parasympathetic nervous system, which then loosens our bowels. So that fear-induced loosening of bowels is actually a parasympathetic overdrive.
And that's sorry, carry on.
Go on.
No, I was going to...
I was just going to tell you the story about the people wetting themselves when they were going over the trenches in the First World War. That loss of bowel and urinary continence is not actually the sympathetic nervous system. It's a paradoxical overdrive of the parasympathetic nervous system, which occurs in response to really high levels of stress. You were going to say something?
I was just going to tie it back to irritable bowel syndrome.
Exactly, yes.
IBS.
IBS is one of the prototypical symptoms of a stressed bowel. And you've also got to remember that there are more nerves in the bowel, there are as many nerves in the bowel as there are in the spinal cord. So the bowel is a very sensitive organ, and any kind of emotional impact that you experience, your bowel will also impact it as well. Your bowel cannot hide from your emotions.
Yep, that's what I usually tell my patients who suffer with IBS. I'm like, if you actually, and they have found it, once the stress or anxiety or depression, whatever mood they are experiencing is actually managed better, their irritable bowel syndrome actually gets better too. Well,
definitely.
And that's, and it's, and it's very interesting, isn't it? Like the fact that they actually still are investigating, like, the specialists, the gastroenterologists who specialize in IBS and things, they're still learning so much about the gut and its innovation. And as what you were talking about, the paradoxical sympathetic nervous system and parasympathetic nervous system, how it all balances out and how it ties in. It's, but we know that, when we're distressed, IBS can also play up.
So our guts are as emotional as our hearts. That's how I sometimes put it. When we fall in love, our guts fall in love. When we fall out of love, our guts fall out of love. When we get stressed, so too do our guts.
Yeah.
Now moving on to the kind of the organ system. So if we look at the gonads, so we actually know that sperm count decreases, fertility decreases, and female fertility decreases if we're stressed. If we look at the endocrine system, we know that in acute stress, we get this adrenaline rush, but also we need to explain the difference between acute stress and chronic stress. So when we get chronic stress, we actually activate our hypothalamic pituitary adrenal axis to produce glucocorticoids, cortisol. And that creates a whole raft of different stresses. So that first stress that we get with the adrenaline rush, was basically designed to allow us to run away from a slavering saber-toothed tiger.
Flight or fight response.
The flight or fight response. But chronic stress has got no place in the world of cavemen, because you either beat the race, survived to live another day, or you didn't. But we also have the secondary system that kicks in the modern day world, and we get this glucocorticoid response that causes a whole raft of problems. But I think of chronic stress causing emotional eating and metabolic syndrome. So explain what metabolic syndrome is to us and how bad that is for us.
So metabolic syndrome is basically when we have a triad of hyperlipidemia, where you have high cholesterol levels, hyperglycemia when you've got high sugar levels, and hypertension when your blood pressure is high. And the way when I see metabolic syndrome, I usually find, we usually sort of associate it with someone who suffers from obesity. That tends to be the classical sort of presentation. Other diseases that come with obviously would be, putting yourself at a higher risk of having a stroke due to all those risk factors which I just mentioned, having a higher risk of having a heart attack and diabetes.
Yeah. And so going back to that point about obesity, so, the key, for me, the key thing is the emotional eating. So we know that people who are stressed tend to emotionally eat, but it's not universal. Figures that I've heard that in terms of total calorie intake, 40% of people increase their calorie intake due to emotional eating. 40% of people decrease their calorie intake and 20% of people stay the same. But for those 40% who are emotional overeaters, they really do put themselves at risk of eating refined foods which are hyperpalatable, which then contribute to the risk factors that you've identified in metabolic syndrome. And so they really do put themselves at higher risk of all of these diseases. So there are two groups of individuals. There are the stress fasters and there are the stress eaters. And it's really probably better for you to actually to be a stress faster rather than a stress eater. Unfortunately, I'm a stress eater. When I'm studying for exams, I put on so much weight because all I can do is eat chocolate all day.
Yeah. Well, I don't know.
Yeah.
I don't know what I am. Sometimes it depends on the stress. Sometimes I'm a stress eater. Sometimes I'm a stress faster. But you know what?
Yeah.
We are all different.
We're all different,
And I think it also comes down to, when we are craving, you talked about the hyperpalatable food, which is basically, your chocolates and your carbs. And I guess it's just that, having that sugar spike and having that good feeling hormones released when you eat chocolates, the endorphins, that just makes you crave those things.
Yeah, exactly.
And also, I guess it comes down to, when we talked about when you're stressed, basically, and how the impact of cortisol levels, what happens is then our body tries to sort of, it's trying to so it's now under stress. So it's saying, I need more energy. So it tries to make more sugar readily available in our body. That's what our body's trying to do. So what happens is then, your insulin levels fall, your glucagon levels and your adrenaline levels increase. And then you have more sugar available in your body. And obviously all that will just cause people to have higher sugar levels. So if you're diabetic, your sugar controls can also worsen. And that has been quite well documented that there isn't that impact of stress and poor control of diabetes. The other thing I wanted to mention is actually immune function. So stress can also have an effect on our immune function.
Yeah, absolutely.
And that comes down to the levels of the cortisol and how it affects our lymphocytes, which are our infection-fighting cells. So that it has an impact on that. And then our immune system is low. I don't know about you, but I've noticed when I'm stressed, I'm more susceptible to more infections. I get sick easier.
Yeah, well, stress increases your susceptibility to things like the common cold, no doubt about it. And remember, stress. When we say the word stress, we're always thinking about an emotional reaction. But stress, in terms of our body's health, is not just our emotional reaction, but also it's our physiological response to trauma or injury. The body doesn't actually differentiate between those two types of triggers because basically they just contribute to this ongoing inflammation. And their inflammatory response is the key physiology that underlines all of these diseases that we've talked about in terms of these chronic diseases. So, the heart disease, the diabetes, the strokes, et cetera, et cetera, et cetera.
I'd like to make a point about that, actually. So when you mentioned inflammation, so when our body is going through a state of inflammation, it actually has an impact on our HDL, which is our high density lipoproteins, the good cholesterol. So it actually lowers our HDL. So that's the impact of stress on cholesterol too. And I guess another area that your area of interest, pain. Would you like to talk us through a little bit about that, or should we do that?
Stress, just very quickly. Stress really triggers pain. Yeah, it makes our appreciation of painful stimulus so much more sensitive. So we become sensitized to pain. It doesn't cause pain, but it's like having a radio. When you've got the radio on at low volume, you've got pain signals. But the same pain signal can be amplified by turning up the knob on the radio volume, and you get a really, really loud response. It's the same amount of electricity going through the radio. It's the same primary trauma, but now you've got this ratcheting up of the volume, and you get this heightened pain signal, and that's due to stress. I mean, another thing also we can touch on, it's very briefly, is the fact that one of the reasons why stress is also bad for us is, it's part of it. It's not only does it cause disease, but also it triggers abnormal coping mechanisms. Now, we've already talked about emotional eating, but we also need to talk about tobacco smoking and alcohol. So tobacco smoking is a response to stress. Stress causes heart disease. Tobacco causes heart disease. So that's a perfect Bermuda Triangle of pathology there. And the same with alcohol. Alcohol causes a whole pile of downstream ill effects, which are concomitant with the downstream ill effects of stress. So, we not only do we have to understand the primary effect of stress, but we also have to put it into the context of the patient in front of us, and how does that patient deal with it, and what are the maladaptive coping strategies, and what are those maladaptive coping strategies doing to the patient's health as well.
Yeah. And just one more point to make is also when you're stressed, your body is sort of going through a state of tension. So you're also actually putting yourself at a higher risk of getting injuries. So, if you're someone who's highly stressed and you decide to go for a jog, or you go to the gym, or whatever it is you might be doing to try to improve, whatever aspect of your health, you're putting yourself at a higher risk of injuries because of that potential tension in the body. And
you're also not sleeping well, and you've got poor attention, and you've got poor work performance, so therefore the rate of accidents at work increases.
Yeah.
So again, that's another way that you're putting your health at risk.
Yeah. So I guess what we're saying here really is that, stress is good if we can manage it and we can use it to perform better. But when we cross that line of, not being able to manage it, that's when it starts having its negative impact on our health. But what I'd like to talk about next is really how we could go about managing it and things. But I think we might have to keep that for the next episode, just as we're running out of time today. So I thank you, Fergal, for joining us today. And I will look forward to speaking to you again about how we can manage stress and improve the quality of our life better. Thanks.
Look forward to it, Savina. Thank you.
That's all for today's show. Thanks for watching. That was our last episode for 2021. Have a great Christmas, and we'll see you in January.